Before you brush your teeth tonight, I want you to understand something that may completely change how you look at your toothbrush forever. Because as a medical doctor specializing in vascular and neurological health, I have seen men in their 50s, 60s, and even 70s regain stronger erectile function not because of pills, but because of something much simpler: how they stimulate specific nerve pathways in their body. And what most people don't realize is that your mouth contains some of the most powerful nerve connections directly linked to your brain, your blood vessels, and your sexual function. And before I explain exactly how this works, I want you to like this video and comment your age and which country you are watching from, because erectile function is deeply connected to age, circulation, and nervous system health. And understanding this can help you protect your body for decades. And now let me explain the science first, because erection is not just about hormones. It is primarily a neurovascular event, meaning it depends on nerve signals and blood flow working perfectly together. And research published in the Journal of Urology and multiple neurophysiology studies has confirmed that nitric oxide released from nerve endings in penile tissue is the primary trigger that allows blood vessels to relax and fill with blood, creating an erection. And when nerve signaling weakens or nitric oxide production decreases, erectile dysfunction develops. The key point here is nerve stimulation, because erection begins in the brain and nervous system before it ever happens physically. And this is where your toothbrush becomes surprisingly relevant, because your mouth, gums, tongue, and jaw are connected to the trigeminal nerve, which is one of the largest cranial nerves in your entire body. And this nerve connects directly to your brainstem, autonomic nervous system, and cardiovascular control centers, and research has shown that stimulation of trigeminal nerve endings can trigger nitric oxide release, vascular changes, and autonomic nervous system activation, which directly influence blood vessel dilation and circulation throughout the body. This is critical because erection depends on nitric oxide and vascular dilation, and anything that improves nitric oxide signaling and nerve stimulation can improve erectile response. And this is supported by another important clinical observation, because researchers from the University of Granada found that men with poor oral health and gum inflammation were significantly more likely to suffer from erectile dysfunction. And in fact, men with gum disease were 2.28 times more likely to experience erectile problems compared to those with healthy gums. And this is because inflammation in the gums damages blood vessels and reduces nitric oxide availability, impairing blood flow to the penis. This proves that your mouth is directly connected to your erectile function, not indirectly, but biologically and neurologically. And now let me explain the practical part, because when you brush your teeth correctly, especially when you gently stimulate your gums and tongue, you activate sensory nerve endings connected to your autonomic nervous system, which regulates blood vessel dilation, heart rate, and circulation, and stimulation of these nerve pathways can improve parasympathetic nervous system activity, which is the exact nervous system responsible for erection, because erection only occurs when your body enters a parasympathetic dominant state, also known as the relaxation and recovery state. And studies on nerve stimulation, including penile nerve stimulation and vibratory stimulation, have shown that activating nerve pathways can increase blood flow and improve erection rigidity within minutes by triggering reflex pathways between nerves and blood vessels. This means your nervous system is the master controller of erection, and when nerve signaling improves, erectile function improves naturally. And now let me explain exactly how to use your toothbrush the right way to maximize these benefits, because the technique matters. And first, you must use a soft bristle toothbrush, never hard bristles, because the goal is nerve stimulation, not injury. And when brushing, gently massage your gum line in slow circular motions for at least 2 minutes, because the gum line contains dense nerve endings that connect to the trigeminal nerve, and stimulating this area increases sensory input to your brainstem and autonomic nervous system. And second, gently brush your tongue, especially the back of your tongue, because this area contains sensory receptors connected to cranial nerves involved in autonomic regulation. And this stimulation can enhance nervous system balance and nitric oxide signaling. And third, breathe slowly and deeply while brushing, because slow breathing activates the vagus nerve, which enhances parasympathetic activity, reduces stress hormones, and improves blood vessel dilation throughout the body, including penile arteries. And this is critical because chronic stress and sympathetic nervous system overactivation are major causes of erectile dysfunction in men over 50. And when you activate the parasympathetic nervous system, you reverse this process, improving blood flow and erectile response. And research also shows that aging reduces nitric oxide producing nerve fibers in penile tissue, which is one reason erectile function declines with age. But nerve stimulation and improved vascular health can help restore function. This is why maintaining strong nerve signaling is essential after age 50. And this is also why therapies that stimulate nerves, including vibratory stimulation and magnetic nerve stimulation, have been shown in clinical studies to improve erectile function by increasing intracorporeal pressure and restoring nerve signaling pathways. This proves that nerve stimulation is not theoretical, it is medically proven, and your toothbrush becomes a daily tool that helps maintain nerve health, gum health, and vascular function. And while brushing alone is not a replacement for overall health, it is part of a larger system that supports erectile function. Because erection depends on 3 core systems working together: your nervous system, your blood vessels, and your nitric oxide production, and brushing your teeth properly helps all 3 by reducing inflammation, improving nerve stimulation, and supporting vascular health. And now let me explain the most important mistake men make, which is brushing aggressively, because aggressive brushing damages gums, increases inflammation, and harms nerve endings instead of stimulating them properly. And inflammation is one of the biggest enemies of erectile function, because inflammation damages blood vessels and reduces nitric oxide availability, impairing blood flow. And this is why gentle stimulation is the key, not force. And when done correctly, brushing becomes a powerful daily signal to your nervous system that supports circulation and vascular health. And many men begin noticing improvements in overall sensitivity, circulation, and morning erections after improving oral health and nervous system balance. And remember, erection is a reflection of your vascular and neurological health. And when those systems improve, erectile function improves naturally. And I want you to start this tonight. Brush gently, breathe slowly, stimulate your gums properly, and support your nervous system daily. And if you are serious about improving your circulation and protecting your erectile health naturally, like this video and comment the word health and your age below, because I want to know who is taking control of their body starting today. And remember, your body has an incredible ability to restore function when you support your nerves, your circulation, and your vascular health. And sometimes the most powerful medical tools are not pills, but the daily habits you practice consistently, starting with something as simple as your toothbrush.